Welcome to this edition of On Politics. I'm Dr. Eric Morrow at Tarleton State University, and we're glad to have a show for you this week and our focus for this week. And we'll get to that in just a moment because I need to do the intro things that we do each week to remind you that we're right here each Sunday at noon on KTRL 90.5 FM. The show is posted to SoundCloud after the show, so you can always go back and listen if you missed the broadcast. Of course, you can, during the broadcast, you can listen either on the radio or at tarletonradio.com for the stream. And then you can follow us on Facebook. You can get episodes where you get your podcast. There's all kinds of different means in which you can interact with On Politics and connect with very critical issues, very timely issues on the local, state, federal, and international level. So we welcome you to engage with us through those variety of ways. But if you have that opportunity on Sundays to join us right here on KTRL 90.5 FM. Now, I've not done this before as a show in terms of focusing on one single issue. Most of our shows have been multiple segments looking at different things, maybe one priority issue or event, and then looking at other events as well or other issues that are timely and connected. And so this makes this show a little bit unique, but it's very timely as well because as I introduced last week in the show, just recently on May 19th, Governor Greg Abbott signed into law one of the nation's most strict abortion measures, which ban procedures as early as 6 weeks into pregnancy. And so abortion is one of those issues that for really 50 years and even a little bit longer than that, and will for many years to come, as we'll emphasize throughout the show, has been a very challenging issue in bringing together a number of factors, of course, that being the role of government in the addressing abortion and how to regulate it, the political ideologies that are engaged with this as well in terms of the emphasis on certain values, whether that's the freedom of a woman to determine the extent of a pregnancy and whether to choose in terms of her body whether or not to carry a child to full term, as well as those on the other side that look at the emphasis on the value of life and protecting the rights of the fetus. There's all different aspects to this. And then, of course, if you look at the related policies to this, such as teen pregnancy and those rates, especially we look at here in Texas, and then we also look at public opinion. We look at the role of religious groups and groups that advocate for civil liberties. I mean, there's just so many different facets to this that make it such a contentious issue. And the focus of the show today is not to resolve the issue. It's not to advocate on one side or the other. It stays with the format of this show, and that is to connect you to the information, the background, the data that you need, the issues that are related to this. Sometimes many of the things that are left out when you get the sound bites through the media or on in a newspaper article and through other resources, it's helping you to engage with that information and resources to then look at how we use government related to this issue. How do we use government? What is the role of government, or what do we see should be the role of government based on what we value, based on how we're going to address some of the challenges and issues that are related to this within our society and within our state. And so I thought this would be an issue that would be great to focus on in terms of a full show because of its complexity, because there are so many facets to it, and there's so many aspects to it that we just need to be aware of in terms of the role of government, understanding that role, and then how we advocate for what that role should be in the future. So to go back just a little bit, because some of this was on last week's show, I don't want to spend too much time here, but it is our starting point because as it has been over many years, we can look back that the state legislature in Texas has had some type of abortion measure on the agenda and has passed many things, as we'll see in a moment when we look at the timeline. So just before we jump into this a little bit, I do want to kind of give you the outline of the show in that we will talk about the recent law that's been passed, but we also want to put that in the context of where we are with abortion and how it happens in the state of Texas. So a little bit of state facts compared to what's happening on the national level, and then look at the timeline, especially over the last decade. I mean, we could go back all the way to the 1990s and even further back than that, when when states began to address certain laws more rigorously, and how those laws have had an impact in the reduction of abortions, but also how this continues to be a very challenging and controversial issue on a number of fronts. So we'll go back and look at the last decade and see where we've come as a state in terms of the decisions our legislature has made to lead to this point, to one of the most restrictive laws that we have seen passed by a state to date, that will also most likely be challenged in the Supreme Court, and as many have before, and will continue us along this line of debate and political conflict and challenges related to the issue. And then the last part of the show, I want to also deal with the political aspects of this, talking about the connection of political parties and ideology. We'll get into that a little bit when we look at some polling, because it always helps to know where people are in the state based on how they engage with this issue and what their views are. But we also want to talk about how ideology is influenced by values and how the ranking of those values often lead to positions on issues like this and what people think government should do or not do. And of course, here in Texas, it's also how those values connect with party affiliation and connect with voting, because decisions are often made based on engaging with those who are voting and what political ideology they hold and what they're looking for in terms of candidates. And of course, in Texas, where we have historically had a high level of social conservatism, especially shown visible in politics, this is really a flashpoint issue. It's a hot button issue. It's one that's in the middle of all of this. But we also don't want to forget, and we'll point to this, that this is a very complex issue that has a lot of policy implications that are oftentimes set to the side in order to focus on this this issue that is such a hot button, this issue that is so at times polarizing, this issue that resonates with many voters, and thus you have politicians that are trying to keep this in front of them and moving it forward in terms of state politics and of course the role of the state related to abortion. So we're going to get to a lot of facets of this today. I'm glad you've joined us right here on KTRL 90.5 FM. And quickly, let's just do a review of this most recent law and why is it different. And we'll see that even more so as we do a little background, as we do a little history. So one of the aspects of this is that Governor Abbott signed it into law on Wednesday, May 19th, that prohibits Texas abortions as early as 6 weeks. And the concern here by abortion rights advocates is that this is even before some women may know that they are pregnant. But it also opened the door for almost any private citizen to sue abortion providers. And this is the unique aspect of this law that makes this one very different from things that we've seen before. So abortion rights advocates have promised to challenge the new law once they consider it now one of the most extreme nationwide and the strictest in Texas since the landmark Roe v. Wade decision. So there's different sides to this. The governor signs the law now as the Supreme Court is also taking up a case concerning a Mississippi law that bans most abortions after 15 weeks. So there's a case ahead of this that will be reviewed, and then most likely the Texas case could follow. And the other parts of it is that the bill bans abortions after a fetal heartbeat has been detected. It does include cases where the woman was impregnated as a result of rape or incest, and there's also an exception for medical emergencies. And this type of bill, or is called a heartbeat bill, that have been passed by other states, have been held up in the courts because of different things. But this is where the Texas version has a different take on it. As the article here in the Texas Tribune says, instead of having the government enforce the law, the bill turns the reins over to private citizens who are newly empowered to sue abortion providers or anyone who helps someone get an abortion after a fetal heartbeat has been detected. The person would not have to be connected to someone who had an abortion or to a provider to sue. So proponents of this new law hope to get around the legal challenges that have tied up abortion restrictions in the courts, where abortion providers usually sue the state to stop restrictive abortion laws from taking effect. Here, there's no state official enforcing the bill, so there's no one to sue in terms of the state. As Josh Blackman said, and I referred to this last week as well, it's a very unique law. He's the constitutional law professor at South Texas College of Law in Houston. He said it's a very clever law. Planned Parenthood can't go to the court and sue Attorney General Ken Paxton like they usually would because he has no role in enforcing the statute. They have to basically sit and wait to be sued. And this has some interesting aspects to it in terms of the constitutional foundations, the legality of it, in terms of the role of government kind of stepping back from enforcement and letting private citizens and others do that in terms of those that provide abortions. So we now have this in place in Texas, and we know that it's going to be challenged in the courts. We know that it will be an ongoing issue, and whatever the courts decide with this will come back to a legislative session in several years. The next one will be in 2023, and then it lead from there, whether there are additional changes that are made, depending on how this law, how it works in the courts, and what are some of the challenges. So one of the things that we want to understand with this, and looking at the context, which I think is always important when we're looking at policy issues, especially controversial ones like this, is to understand what is happening with abortion in Texas. Now, when we look at this nationally, when we look at what's happening around the country in terms of abortion and where we are, and how Texas compares with other states, the trend has been connected, of course, to pregnancy rates, which we've seen decline since the 1990s, the early 1990s. Teen pregnancy rates, and that's what we would consider women younger, 24 or younger, have been declining. So this is 20 to 24, 18 to 19, 15 to 17, under 15. I mean, these rates have been declining considerably during that time. And of course, abortion rate has fallen as well. Since the early 90s, it has dropped considerably, where you see a national rate of that was almost 40% or 40 women every per thousand having an abortion, to now looking at that average that has dropped below to around 8 or 9 abortion events per 1,000 women, which that's very, very interesting to see that decline. And of course, a lot of that's attributed to more strict abortion laws post Roe v. Wade, and especially in the early 90s when there was this push to kind of address this dramatic increase in abortions. We can look at this by state as well. When we compare the pregnancy rate, and I bring in the teen pregnancy rate because it's something we have to look at, especially since Texas has one of the highest rates. We're in the top 10 states in the U.S. in terms of teen pregnancy rates, and it's those rates that have an impact on abortion and, of course, access to abortion. And when we look at this, the data that I'm looking at now comes from the Guttmacher Institute, and it's a little bit dated. We're talking about 3 or 4 years ago. But at that point in time, the pregnancy rate of young women aged 15 to 19 in Texas were 39 per 1,000 women. Okay, so that's one of the higher rates in the country. Now that if you look at it currently, that has dropped some in the last few years. We have some data now that shows that we're like in the mid to upper 20s per 1,000. So it continues that trend of dropping, but it's still a critical factor. It's still one of those factors that influences access to abortion and the need for abortion. And so the summary here, when we look at this nationally, and then let's talk a little more about Texas, it says that although pregnancy rates among women aged 24 or younger have been declining during the past 2.5 decades, rates among those older than age 30 have been increasing. So again, this is another area, another factor that has to be looked at. These patterns reflect different underlying trends in birth and abortion rates. Pregnancy rate declines among young people have resulted from declines in both birth and abortion rates, while the abortion rates among older age groups have stayed mostly constant as birth rates have increased. Trends over time at the state level have generally mirrored national trends. However, there are strong geographic patterns. Pregnancy rates in 2017 were higher among younger people in the South and Southwest compared with other regions, and for older age groups in the Northwest and the Northeast. And I think that's something that's interesting to look at when you talk about abortion and teen pregnancy in Texas, is that we're very close in number to many of the states here in the Southwest and the South, such as New Mexico, Oklahoma, Louisiana, Arkansas, Mississippi, even Alabama, Tennessee, and Kentucky. These are some of the states that have some of the highest teen pregnancy and abortion rates in the country. And so these are related issues, something that we just need to understand, because it seems like the states that have moved to do more related to teen pregnancy, especially in terms of sex education, that there has been more of an impact on diminishing teen pregnancy and thus also diminishing abortion. And so that's a challenge in Texas, because the majority of our schools, I think it's 50%, are abstinence only. There's more than that if you add them all together, we're up in the 70% or so that do not teach any kind of alternative safe sex education and those kinds of things. And again, this goes along with this social conservatism that we'll talk about later in engaging with these issues and trying to help young people and teens address them and understand them in order to navigate them and to not see if there can be an impact on pregnancy rates and on abortion. Just to look at some of the numbers here, this is in addition to that context of where Texas is on a national level. If we go back, this data that I have most recently is from 2017. The resulting abortion rate in the United States as a whole was 13.5 abortions per 1,000 women of reproductive age. That's between 15 and ages 15 to 44. In 2017, 55,440 abortions were provided in Texas. Some patients may have traveled outside to other states, and some may have traveled into Texas. But this showed a 3% decline in the abortion rate in Texas between 2014 and 2017, from 9.8 to 9.4 abortions per 1,000 women of reproductive age. Abortions in Texas represent 6.4% of all abortions in the United States. In Texas, too, and this is always a focus of laws, as we see in this most recent law, are the facilities, abortion providers. In 2017, there were 35 facilities providing abortion in Texas. 21 of those were in clinics. These numbers represented a 25% decline in clinics from 2014, when there were 44 abortion providing facilities, of which 28 were clinics. And in 2017, some 96% of Texas counties had no clinics that provided abortions, and 43% of Texas women lived in those counties. So that's some of the facts that are close to our time period. We know that more of those numbers have gone down, and of course, laws that have been passed have been focused on trying to reduce those rates, abortion rates, even more through restrictions on clinics, through restrictions on time, how many weeks of gestation before that limit an abortion. And so I want to give a little bit of attention to that as well, talking about abortion legislation and what has been the focus of that over the last decade. And so this would take us back to 2011, where Texas began. And think about before this too. We could go back further than that because there have been even more attempts to address abortion in the state. But we can see this consistently over the last decade and the legislative sessions that have been had during that time, that there's been a very concerted attempt that aligned with the party affiliation and political ideology within the state. Again, we'll look at that in a moment when we talk about a little bit of polling. But let's talk about the laws and how they've developed. In 2011, Texas enacted legislation. This would have been from the 2011 legislative session, but in September 1, this law went into effect that cut funding for family planning services by 2/3. The budget for this went from $111 million to $37.9 million for the 2012-2013 budget period. And so that was a major impact on family planning services. In October, Texas submitted a renewal application for a state Medicaid waiver program, the Women's Health Program, which would exclude organizations affiliated with abortion providers, such as Planned Parenthood. So they're trying to cut off funding being used in the state related to Planned Parenthood. 2012, the legislative session, Texas requires a sonogram bill before abortion. House Bill 15 goes into effect. This was following that 2011 legislative session that requires the same physician who will carry out the abortion to perform an ultrasound scan 24 hours before the abortion, display the image, and provide a description and make the fetal heartbeat audible. Therefore, the law mandated that women come to the facility for 2 visits at least 24 hours apart, and in order to go through this process, again, with the attempt of trying to persuade women not to go through with the procedure. In March of that year, 2012, the request to exclude Planned Parenthood from the 90% federally funded Medicaid waiver program is denied. So again, this tension and this challenges between state government and the federal government. By December of that year, the end of the year, federal funding for the Women's Health Program is discontinued. And the state begins in January of 2013 to administer the Texas Women's Health Program using state revenue to cover $30 million of annual federal funding that had previously supported the program. Organizations affiliated with abortion providers were excluded from the program. So we see a pattern here, and we're going to see it continue, because in July of 2013, the law imposes 4 new abortion restrictions in Texas after 2 special sessions called by Governor Rick Perry signed House Bill 2 into law, which included these 4 abortion restrictions. Abortions are banned at 20 weeks post-fertilization or 22 weeks from the woman's last menstrual period. Physicians performing abortion must have admitting privileges at a hospital within 30 miles of the facility. The provision of medication abortion must follow the protocol described in the labeling of mifepristone approved by the U.S. Food and Drug Administration. And then all abortion facilities must meet the standards of ambulatory surgical centers. So the first 3 of these went into effect on November 1, 2013. The 4th one went into effect on September 1, 2014. And of course, several of these provisions are challenged in the courts by Planned Parenthood and the U.S. Court of Appeals for the Fifth Circuit upholds parts of the law. So again, some of these restrictions go into effect. Some of these continue to be challenged. The Fifth Circuit rules in favor of House Bill 2. The ambulatory surgical center requirements go into effect. And the Fifth Circuit determined that House Bill 2 could be enforced while the appeal moved forward. On October 3rd, the HB 2 provision that requires all abortion facilities to meet the standards of an ambulatory surgical center goes into effect. This was then appealed, of course, to the Supreme Court. On October 14th, 2014, the U.S. Supreme Court permits facilities statewide to remain open without meeting ambulatory surgical center requirements and prohibits enforcement of the admitting privileges requirement in the plaintiff's facilities in McAllen and El Paso. So this decision was in effect until the decision of the Fifth Circuit Court of Appeals was final. June of 2015, this stretches into 6 more months, the Fifth Circuit Court upholds the ambulatory surgical center requirements. And of course, this was focused on raising the equipment and standards and facilities really to a point, too, that most abortion clinics could not stay operational because of the cost of doing this. In June also of 2015, Texas signs into law House Bill 3994, making it harder for pregnant minors to obtain a judicial bypass or court approval to get an abortion without parental consent. In June, the end of June that year, the U.S. Supreme Court approves emergency appeal to the Fifth Circuit's decision to uphold the ambulatory surgical center requirements. The clinics in Texas could continue to legally provide abortion care without meeting the requirements of that law in House Bill 2. And by November, then, the Supreme Court agrees to hear a challenge to House Bill 2 and announced that it would hear this challenge and then first requires physicians who perform abortions to have admitting privileges. Again, more aspects of that law being looked at. This will go all the way into 2016. Where you have several other challenges. In March 2nd, the challenge is heard before the Supreme Court. In June of 2016, the U.S. Supreme Court rules abortion restrictions as unconstitutional. The U.S. Supreme Court rules that 2 provisions of House Bill 2, hospital admitting privileges for physicians and the ambulatory surgical center requirement, unconstitutional, stating that if enforced, they would place an undue burden on women's access to abortion and offer limited health benefit. In July of that year, Texas had already been moving forward with its own women's program called Healthy Texas Women. It begins in July of that year, 2016, serving women ages 15 to 44 with incomes at or below 200% of the federal poverty level, and provided women's care and contraceptive methods. Pregnant women who received care under Medicaid were automatically enrolled into the Healthy Texas Women's program, thereby preventing gaps in coverage. Texas then, by the end of that year in December, plans to remove Planned Parenthood from state Medicaid program, which decreased funding for that by $3.1 million in Medicaid resources. Of course, that gets stopped in the courts. And in 2017, by June of 2017, Governor Greg Abbott signed into law Senate Bill 8, which required fetal tissue to be buried or cremated and prohibited dilation and evacuation abortion procedures. So again, another approach to this in terms of remains, in terms of the procedure itself. I mean, what we've seen is a pattern here, and that continues, of looking at various parts of abortion and how to engage with it to restrict it or to create a challenge in one area that would then have an effect on its availability in other areas. So let's move on to 2017. Again, August of that year, Governor Greg Abbott signs 2 pieces of abortion legislation into law. These restrictive laws include House Bill 13, which will require additional reporting on complications from abortion, and House Bill 2014, which prohibited primary health insurance plans from covering most abortions. August 16th, the next day, a law requires additional reporting for abortions performed on minors goes into effect. The state then also extended the Maternal Mortality Task Force, where Governor Greg Abbott signed Senate Bill 17, which was a look at trying to address why Texas has the highest maternal mortality rate in the developed world. August, later that month, a judge temporarily blocks the law restricting dilation and evacuation abortion procedures. And then in November, the same judge rules that abortion restriction is unconstitutional related to Senate Bill 8. That brings us into 2019, and then, of course, up to this next legislative session, which we've already talked about, what was recently signed into law. But in January of 2019, the People's Lawsuit challenges Texas abortion laws. The lawsuit, Whole Women's Health versus Paxton, also known as the People's Lawsuit, opens in court. And Morrow, the pro-choice Texas group, along with other Texas abortion funds, providers, and grassroots groups, filed the collective suit on June 14th to challenge the Texas abortion laws. And in March of 2019, Texas sees Title X grantees announced by the U.S. Department of Health and Human Services, which was the list of Title X grantees. Women's Health and Family Planning Association of Texas receives the Major Texas Award of $14 million. Now, I know that was a quick run through. I'll post this document from the Texas Policy Evaluation Project on the Facebook page, but I do that to show you that there's an ongoing back and forth between Texas trying to limit or regulate or restrict certain aspects of the abortion process, followed by court challenges, followed by laws being overturned, followed by tweaking of those laws with an attempt to do it or to go in another direction, which is what we saw with this most recent law. Here is an attempt to deal with some of the ways in which these things are challenged. So no longer is it the state that's the focal point of enforcement. It's given over to the people who can sue abortion providers if they see that they think that they violated the law. Now, that's going to be interesting, too, to see what is the state's role in that, then, in determining enforcement here, not just through the courts, but in terms of here's a law and whose responsibility is it to enforce that law if it's broken. You wouldn't want to go down that path in other areas that you leave it up to citizens to enforce the law. That's what's kind of interesting here is this kind of theoretical concept behind it of how you go about using people and their views on this to then enforce it because through litigation. So we'll be looking more at that as that goes forward and, of course, is challenged in the courts. What I'd like to do now in order to transition here and talk about some other facets of this, especially statewide polling, where are people in Texas on the abortion issue? There's some recent polls out in the last few months that give us a glimpse of this and connect it to everything from party affiliation to religiosity, as well as talk about some of the politics and policy aspects of this going forward. So we're going to take a quick break, and we'll be right back for more on politics.
I'm Rissa.
I'm Taylor.
And we are
the Music Business Babes. Music Business Babes is a music-based bi-weekly podcast where we answer tough industry-related questions,
discuss updates in the industry,
provide insight from our own personal experiences,
and share fun stories along the way.
You can catch the show by searching for Music Business Babes
or Tarleton Radio Network,
wherever you get your podcasts.
Welcome back to On Politics. I'm Dr. Eric Morrow, and we're glad you're joining us today right here on KTRL 90.5 FM or live stream through tarletonradio.com. Today's topic is a single topic show on the issue of abortion. And in the first part of the show, we kind of look back at the context of this issue in Texas, starting with the recent law that was signed into effect by Governor Abbott, one of the most restrictive laws to date in Texas and in the nation related to abortion, knowing that we will probably see this challenge in the courts going forward, but also looking back over the last decade and how Texas has addressed this issue through the legislative action, through the courts, and talking about kind of the current status of abortion in Texas. And so all of that is there. I'm going to post related articles with data and information on the Facebook page that's On Politics with Eric Morrow. But I wanted to start with this last part of the show, looking at a couple of things. And one of those, when we talk about this issue and many issues, and this in the focus of the show, and we connect it to politics and we connect it to the engagement of people in the body politic, the people out there who vote and have views on these issues and want then to impact government in its relationship with these issues. This becomes very critical because it does impact voting. It is an aspect of issues like this that are looked at by those who are running for office and those who are serving in terms of the kinds of issues that they engage with. And as we've seen, the Texas government in Texas become more dominated by the Republican Party over the last several decades, abortion has been an issue that has been front and center. Now, if we go back to the 20th century, we can see that Texas, throughout that century, social conservatism has always been a part of politics in the state. It's always been an influence. And it's really not until the latter part of the 20th century that we began to see social issues become a very prominent, much more prominent in politics, and much more divisive in terms of party alignment and how parties looked at these particular issues. And one of the things I always like to explain in my government classes is not to engage with that, to think that, oh, this party is good and this party is bad. It's important that we look at these issues in terms of how different political parties and different political ideologies are ranking their values related to these issues. Okay, it's much more complex than saying, oh, this is a good perspective and a bad perspective. We lean that way because of our own ideas and how we see these issues, how we rank our own values, or how those values have been shaped by political socialization, the where we grow up, the family we grow up in, the influence of education and religion and so on. All of that helps to shape our kind of worldview and thus how we see these particular issues. But when we dive into them in terms of political parties and engagement with the issues, it's important to look at how groups and people rank their values. For instance, a big debate in our country over the last decade has been health insurance, providing access to health care by ensuring that everyone has some access to health insurance, whether it's government provided health insurance like Medicaid or Medicare, it's private insurance provided by insurance companies, or is it the government facilitating, like we saw with the Affordable Care Act, providing access to where people can go into the private marketplace and buy insurance, have access and be able to afford insurance. And so the debate has been, how do you see that? And you have some that have a more a view on this of emphasizing the value of freedom. Well, it's my choice whether I have insurance or not. It's not the government's role to tell me that I have to have insurance. Of course, we all know the cost of medical care and access to it, how much that cost has risen, and how much of a challenge it can be when people need it. But there's still this kind of underlying ideological foundation that says, I need to be free to choose whether, with my resources, that I want to buy insurance or not. I mean, we can go back and when I was growing up, it was seatbelt laws and motorcycle helmet laws and open container laws and so forth. Government kind of intruding into private space as it was perceived and saying, well, no, you can't do this because it could very often result in this, endangering someone's lives or providing safety as well. So the ranking of values can be important, whereas like The other side of this with health insurance is, or access to health insurance and health care, is an issue of equality. So someone may emphasize equality much more than they do freedom when it comes to this issue. For them, it's important that everyone has access to health care and that government has a role in addressing that, because it is a very complex and costly aspect of our society and of our lives. So when we come to abortion, it's very much that same way. Is where do people stand in terms of what they value? Is it as a part of the social conservatism? Is it this emphasis on the traditional values of related to marriage and family, and in this case of life, of saying that, well, we value life, however it comes into existence. We are valuing life above all things. Or then that's on one side, or the other side to say, well, we value in this case freedom. It's the right of the mother. The mother should be free to the woman to choose whether she wants to have this child or not. It's her body, and she should then be able to make that choice. And then you have a lot in the middle where we see, especially in the legal side of it, in some of these places where there are exceptions for if the woman's life is in danger, or if the pregnancy is a result of rape or incest. I mean, there are these kind of gray areas that we wrestle with, that oftentimes those values become a little more challenging to use as a guide in how we address these things, because we know our human condition and experience changes and is different for every person, and every situation is very different. So before we get any further in that, I know we don't have a lot of time left today. I do want to talk a little bit about where we are in terms of public views on abortion. And so the Texas Politics Project, which I'll link to these polls on the Facebook site, that's On Politics with Eric Morrow. There was a poll that this is a regular polling that's done by the University of Texas and the Texas Tribune. And in April 2021, the question was asked, do you support or oppose automatically banning all abortions in Texas if the Supreme Court overturns Roe v. Wade? And of course, in this Mississippi case that's gone forward to the Supreme Court, Roe v. Wade could be under review as the Supreme Court takes up that case. So this was asked in this polling across a wide demographic differences and trying to encompass as many variations that represent the majority of Texans across the state. And overall, the poll showed that 22% strongly support, 12% somewhat support. So on the support side, that's about 34%. Somewhat oppose or strongly oppose was 12%, and then strongly oppose 42%. So really this poll leans more toward those who are in opposition of banning all abortions in Texas if the Supreme Court overrules Roe v. Wade. By party ID, of course, this would be assumed that strong support was there. 39% of those who identify as Republicans, 19% somewhat support, 39% strongly support. So we're looking at a majority there of Republicans. Oppose, 74% Democrats strongly oppose, although you do have some smaller segments there of Republicans as well. But you can clearly see that opposition and support along party lines. When you look at it by identification, again, those who identify as Democrat, whether lean Democrat, not very strong Democrat, or strong Democrat, the majority are opposed to overturning Roe v. Wade, whereas on the Republican side, again, strongly support. So it's very clear, and this is one of the reasons why this issue is going to be challenging going forward, especially with party transition in Texas, is that you see parties clearly aligned on each side of this issue. When you look at it in terms of ideology, you see that liberal political ideology, which emphasizes more equality in this case, and freedom, and the right to choose, the right to access, that liberals are much more in support or opposed to overturning Roe v. Wade, whereas conservatives not quite as much. I mean, between strongly opposed by liberals is 81%, whereas strongly support and somewhat support among conservatives is only at about 60%. So you can still see that there is some variation here in terms of this issue. Now, let's look at another question while we have some time here as well. The question was, do you support or oppose allowing any individual in Texas the right to sue an abortion provider? So this was asked knowing that law was coming up. And then the other poll after this, which I'm not sure we'll have time to get to, but it said, do you support or oppose making abortion illegal after 6 weeks of pregnancy? Okay, in both of these polls, what we begin to see in the overall poll is, again, this different sides that are about even. The right to sue an abortion provider, 30% strongly supported, 14% somewhat supported, so 44%. 8% somewhat opposed, 29% strongly opposed. That works out to about 37%. Again, when you look at this along party ID, you see that 49 strongly support, 17% somewhat support among Republicans, whereas 54% and 8% either somewhat opposed or strongly opposed among Democrats. Again, you have to look at these polls, and again, I'll link to them because these are something to engage with and just kind of see where the population is in the state. And then just briefly, the support or oppose making abortion illegal after 6 weeks of pregnancy, 34% strongly support and 15% somewhat support, so right at 49%, whereas 10% somewhat oppose, 31% strongly opposed, right at 41%. But again, when you look at party ID, you see it almost even between Republicans supporting limiting abortion, Democrats opposing limiting this limit on abortion. So there's more polls here that go back. This last one was done in April of 2021, but it helps you to see how challenging an issue is like this within the political context of the state of Texas, when we're looking at, even though Republicans are very much in control of state government in the executive and legislative and even the judicial, we still see the growth in the Democratic Party, and we could see a more transition in government in Texas. We didn't see it in this last general election, where Republicans overall only lost one seat. It was anticipated that Democrats would have a stronger showing, but it didn't happen. And part of that was due to turnout across the state. Will that be reduplicated in future elections? We will have to see. But what I want to focus on here, just in closing, is the part of the reason why we're looking at this today and why we need to consider the different facets of this, from current law and what's happening there to what has happened in the last decade and even further back, to public opinion and polling on these issues, to the current context of what abortion is in Texas. What are the facts about it? How is it offered, delivered? How many abortions do we see? To related issues like teen pregnancy and access to health care, because all of this becomes intertwined in a very complex policy area. And you need a knowledge of this. You need to be able to engage with this, even if you have very strong views on this issue, either pro-life or pro-choice, wherever you are in terms of party affiliation or ideology, how you rank your values. That puts an emphasis on how we use government and what you support in terms of the role of government in dealing with this issue. But I also say, and this is what often gets overlooked, the auxiliary issues. So if we're going to have stricter abortion laws, how are we addressing teen pregnancy? How are we addressing the support services for the care of children who either need to be adopted or in foster care? We have some challenges in that in Texas. We've had a long history here now, or I should say a short history, of going after abortion providers and putting in strict laws and trying to push the envelope of where those laws are and how restrictive they are. But how much have we, in the other direction, gone to addressing some of the root issues of this? And of course, as we've seen teen pregnancies decline across the country, we've certainly seen abortion rates decline in that age group. But a part of that too is then what are we continuing to do? Because we always know that no matter how restrictive these are going to be, there's still going to be ways around them. There's still going to be abortions, or there's still going to need to be alternatives, right? Alternatives that, and we have to debate and discuss how much should we use government as a part of that solution in terms of those alternatives, because certainly what the private sphere provides in terms of adoption, foster care, healthcare, and so on is not sufficient, because you see the teen pregnancy rates and abortion rates, especially among those who are on the lower socioeconomic levels within our state, and you see among those who have less access to healthcare and less access to insurance. That this is where a lot of this is happening, and thus needs to be addressed in some other way. Some of these issues have not been front and center in terms of how the state engages. And some of these are more challenging, right? They're not those magnetic issues like abortion that draw people to a certain one side or the other, and thus make a lot of waves and help to get someone reelected, or help to say, hey, look at what I'm doing on the part of our party or our ideology or my constituents. But they're issues that do need to be addressed. And I think what I do here, and what we'll do with issues in the future as well, and we've done this some in the past, is that we'll advocate that we all need to know more. We need to engage more and have more knowledge of where these issues are, what their background is, what's the status in public opinion, what's the status in legislation in our state, and then what are related issues that need to be addressed as well, so that we can be a part of the solution in terms of quality of life in our state, how we use government, and how we engage through government in addressing critical issues in our times. So that's a wrap on one show on a specific issue, which we've don't believe we've done before, but I think it will be something that we'll be looking at, especially in focusing on specific policy areas. I'm glad that you joined us today right here on KTRL 90.5 FM. Join us each week, Sundays at noon, for On Politics with Eric Morrow. Have a great Memorial Day holiday, and we will be back with you again next week.
This has been a Tarleton Radio Network podcast with production from me, Taylor Welch.
And me, Carissa Cole.
Find more great shows by searching Tarleton Radio Network wherever you get your podcasts.